A man in New Mexico picked up dead prairie dogs with his bare hands. Within days, he was in the emergency room with a disease most doctors assume disappeared in the Middle Ages: the Black Death. Not in 1348, not in some history textbook, in 2020's America, on a quiet rural property outside Santa Fe, where the most dangerous thing was supposed to be the summer heat. JP was 52, generally healthy, no major medical problems. He lived on a stretch of land where prairie dog colonies dotted the landscape like small dirt cities, and most days he barely noticed them. Then the animals started dying, dozens of them, scattered across the colony, stiff and still. JP did what seemed reasonable. He grabbed a shovel, walked out in the afternoon sun, and started clearing the carcasses with his bare hands. A chore, nothing more. What JP did not know was that the dead prairie dogs littering his yard were the first warning sign of something that had not changed its playbook in 700 years. 2 to 6 days later, JP woke up shaking. 4 degrees Celsius, 103 Fahrenheit, and the rigors would not stop. Whole body tremors, teeth chattering. But the fever was not the thing that sent him to the emergency department. It was the lump, a swollen lymph node in his left groin, angry and hot, stretched somewhere between 3 and 8 centimeters. A bubo. That word comes from the Greek bubon, meaning groin, because that is exactly where the ancient physicians first saw these monstrous swellings appear. The skin over it was red, erythematous. Erythema from the Greek erythros, meaning red. The node was exquisitely tender. JP could barely walk. On top of that, severe malaise, a pounding headache, and muscle pain that seemed wildly out of proportion to a single swollen lymph node. Something deeper was happening, something systemic. His heart rate was climbing. The ER team saw early sepsis markers, and the infection had not even fully left the lymph node yet. The emergency physicians looked at the bubo and could have called it an abscess, could have started broad-spectrum antibiotics and scheduled a surgical consult. But someone in that ER asked the right question. Where do you live, and have you had any animal contact? JP mentioned the prairie dogs. That single sentence changed everything. They aspirated the bubo with a needle and sent the fluid for gram stain. Under the microscope, the microbiologist saw something that made the room go quiet. Bipolar staining gram-negative coccobacilli. Coccobacilli, from the Greek kokos meaning berry and the Latin bacillus meaning small rod, because these bacteria are shaped somewhere between a sphere and a rod. And the bipolar staining pattern, dark at both ends and pale in the middle, gave them the classic safety pin appearance. There is exactly one organism that looks like that in this clinical context. The word plague entered the room. The New Mexico Department of Health was called immediately. Plague is not a disease you report when you get around to it. It is immediately reportable, mandatory, right now. They started IV gentamicin before the culture results were back, because if they were right about what was growing inside that lymph node, every hour of delay rewrote JP's odds of survival. Within the first 24 hours on gentamicin, something remarkable happened. JP's fever broke. His heart rate settled. He was sitting up, talking, eating. The team allowed themselves a cautious breath. Then the fever came back. The bubo became more tense, more fluctuant, and fresh blood work told a darker story. The bacteria were breaching the walls of the lymph node, leaking into the bloodstream. This is the transition from bubonic plague to septicemic plague. Septicemia, from the Greek sepsis, meaning decay, and haima, meaning blood, decay in the blood. And Yersinia pestis in the bloodstream is not a slow threat. Under laboratory conditions, at body temperature, it doubles roughly every 90 minutes. That is exponential math working against you. One bacterium becomes 2. 2 become 4. 4 become 8. Within 12 hours, a single organism can become over 250. Within 24, over 65,000. The gentamicin was holding, but the margin was razor thin. The bacteria were in his blood now. What happened next depended on a molecular arms race that has been running since the 1300s. If this is the kind of case that makes you want to understand how ordinary moments become medical emergencies, and you have not yet subscribed, now would be a good time. Because the answer to whether JP survived comes down to cellular machinery that most people have never heard of. But before the resolution, the team had to be sure. Because a swollen, painful lymph node with fever and sepsis has more than one possible explanation. Consider tularemia. Francisella tularensis is also endemic in New Mexico, also transmitted by arthropod bites, also causes painful lymphadenopathy after animal contact. It is a strong candidate. But tularemia buboes are typically less acutely hemorrhagic than what JP presented with, and tularemia usually leaves a more prominent ulcer at the bite site, the ulceroglandular form. JP had no obvious ulcer. Consider cat scratch disease, Bartonella henselae, regional lymphadenopathy after flea exposure, common in the Southwest. Plausible on paper, but cat scratch disease is indolent. It develops over 1 to 3 weeks, lower fevers, less acute pain, and JP had no cat exposure. Consider a straightforward staphylococcal or streptococcal lymphadenitis. An infected node in the groin with fever is something emergency departments see regularly. But the systemic toxicity here was wildly disproportionate to the local findings. There was no skin wound, no cellulitis, no clear entry point for a common skin bacterium. Consider lymphogranuloma venereum, caused by specific strains of Chlamydia trachomatis. It can produce a painful inguinal bubo with systemic symptoms. But there was no genital ulcer, no sexual risk factors, and the timeline was wrong. LGV typically takes 3 to 30 days with a prodromal ulcer phase. The timescale heuristic settled it, 2 to 6 days from exposure to explosive systemic illness. That incubation window, combined with the gram stain morphology, the prairie dog die-off, and the geographic location, pointed to one organism. Every road led back to the same answer, one that most doctors will never see in their entire career, but that New Mexico emergency rooms have learned never to forget. To understand how a medieval disease ended up in a man's bloodstream in modern Santa Fe, you have to follow a trail that starts in Hong Kong in 1894. The third pandemic was tearing through Asia. At the Kennedytown Temporary Hospital, a Swiss-French bacteriologist named Alexandre Yersin was aspirating fluid from the buboes of plague victims. Working in a grass mat hut the colonial authorities had grudgingly provided him, Yersin isolated a small gram-negative rod from the aspirates and sent his samples to the Pasteur Institute in Paris. Working independently and just days apart, the Japanese bacteriologist Kitasato Shibasaburo also reported isolating an organism from plague patients. But Kitasato's cultures were later shown to be contaminated with pneumococci. Yersin's isolate proved definitive. 4 years later, in Karachi in 1898, a French physician named Paul-Louis Simond conducted an elegant experiment proving that fleas were the bridge between infected rats and humans. The transmission cycle was finally understood: rat to flea to human. Then, in 1900, plague arrived in San Francisco aboard ship rats. Public health officials contained the urban outbreaks, but the bacterium did something no one anticipated. It jumped from urban rats into wild rodent populations: prairie dogs, ground squirrels, wood rats. It established a permanent sylvatic cycle across the American West, quietly circulating in wild colonies year after year. It never left. In 1970, the organism was officially renamed Yersinia pestis in Yersin's honor. Today, New Mexico leads all U.S. states in human plague cases, accounting for roughly half of the national total, with most years recording between 1 and 17 cases. Domestic cats that hunt infected prairie dogs have even caused secondary pneumonic plague in their owners, transmitted through respiratory droplets. The same bacterium Yersinia pulled from corpses in 1894 Hong Kong was now multiplying in JP's bloodstream in Santa Fe, and the molecular weapons it was using had not changed at all. Back to JP. Blood cultures and bubo aspirate confirmed Yersinia pestis by PCR and culture within 48 hours. Now here is what that organism was doing inside his body, step by step. It started in the flea. Yersinia pestis multiplies in the flea's midgut and forms a sticky biofilm that physically blocks a valve called the proventriculus. The flea cannot feed properly. It is starving, so it bites more aggressively, and with each bite, it regurgitates bacteria directly into the host's skin. Once inside JP's dermis, the bacteria deployed a molecular weapon called a type 3 secretion system. Think of it as a molecular syringe. It injects proteins called YAP effectors directly into the immune cells that arrive to fight the infection. YAP-H, YAP-E, YAP-J, YAP-T. Each one targets a different part of the phagocyte's internal skeleton, the actin cytoskeleton that the cell needs to engulf and destroy invaders. The result is paralysis. The immune cells show up to the fight and cannot move, cannot eat, cannot kill. The bacteria replicate unopposed. They travel through the lymphatic vessels to the nearest regional lymph node, in JP's case, the left inguinal node, because the flea bite was on his leg. Inside that node, massive numbers of neutrophils flood in, but cannot contain the infection. The result is hemorrhagic necrosis, tissue death and bleeding inside the node itself. That is the bubo, a lymph node destroying itself, trying to contain an enemy it cannot touch. Without antibiotics, the next step is inevitable. Bacteria escape the node into the bloodstream, septicemic plague. Then, disseminated intravascular coagulation, DIC, where the clotting system activates everywhere and nowhere at once. Endotoxic shock. And potentially, the bacteria seed the lungs, creating secondary pneumonic plague, which is then transmissible person to person through respiratory droplets. That is the nightmare scenario. But for JP, the gentamicin held the line. The team adjusted dosing, maintained aggressive IV therapy, and the second fever spike broke. He was transitioned to oral doxycycline once he showed sustained clinical improvement. The bubo drained spontaneously over the following weeks and resolved on its own. JP walked out of the hospital on day 5, full recovery. Close contacts received prophylactic doxycycline per CDC guidelines. The New Mexico Department of Health completed its investigation. JP walked out of the hospital 5 days after arriving with a disease that killed half of medieval Europe, because someone in that ER remembered what a safety pin-shaped bacterium meant. 4 things worth carrying with you. First, if you live in or visit the western United States and you see dead rodents, prairie dogs, squirrels, rats, do not touch them. Gloves, a bag, and call your local health department to report the die-off. That phone call can prevent the next case. Second, May through October, in plague-endemic regions, use EPA-registered insect repellent, DEET or picaridin on your skin, permethrin on your clothing. The flea is the bridge. Block the bridge. Third, if you have pets, especially cats, do not let them hunt rodents. Use veterinary flea control year-round. Cats can develop pneumonic plague from a single prairie dog kill and transmit it to you through their breath. Fourth, and this is the one that saves lives directly. If you ever develop a sudden high fever with a painful, swollen lymph node, and you have had any exposure to rodents or fleas, tell the emergency room about the animal contact. Say the words out loud. Plague is treatable with common antibiotics, gentamicin, doxycycline, drugs that every hospital stocks. The mortality rate with early treatment approaches 0. Without treatment, it exceeds 50%. The difference between those two numbers is not some exotic intervention. It is a single sentence from a patient to a doctor. This disease has earned a 700-year reputation as an unstoppable force. It is not. It is a bacterium. It has weaknesses, and now you know them. Be aware, be prepared, take care of yourself, and we will see you in the next one.